Hi, good afternoon, friends. I'm Debabrata Mukherjee. I'm the chair of the Department of Internal Medicine at Texas Tech University Health Sciences Center at El Paso, Texas, and the program director for the Cardiology Fellowship Program at Texas Tech. Okay. My presentation at CSI is on primary prevention of cardiovascular diseases. And I want to focus on what we can do with lifestyle and early therapy of certain conditions to prevent cardiovascular disease. Now, I'm an interventional cardiologist by training, and I like to fix things, but it has been said that an ounce of prevention is worth a pound of cure. If we can prevent cardiovascular disease or people from developing blockages in the heart, in the brains, preventing heart failure, atrial fibrillation, it is certainly the best way to tackle the cardiovascular endemic. Now, what does prevention or primary prevention entail? Primarily entails a healthy lifestyle throughout your life, which means regular exercise, eating right. What does eating right mean? It means a diet which is rich in fruits and vegetables, rich in whole grains, rich in nuts. And if you are a non-vegetarian or a meat eater, eating white meat like chicken, like turkey, and fish is good. Avoiding red meat, avoiding fried food on a regular basis is also part of a healthy lifestyle. Exercise is key in preventing cardiovascular diseases. How much exercise and what kind of exercise? If you like to do vigorous exercise like running or doing something pretty strenuous, playing basketball, about 75 minutes of exercise in a week is reasonable. But for moderate exercise like walking or jogging, 150 minutes of exercise per week is recommended to maximize the cardiovascular benefit. With understanding the benefits of exercise is a spectrum. Some exercise is better than no exercise. Other lifestyle things, avoiding tobacco use, which is a key risk factor for cardiovascular diseases, is important. If somebody has high blood pressure, treating the blood pressure appropriately is very important. Treating diabetes appropriately and keeping the glycated hemoglobin close to 7 is extremely important. If somebody does these things, exercises regularly, eats a healthy diet, doesn't smoke, keeps an eye on their blood pressure, diabetes, and finally their bad cholesterol or LDL cholesterol, this will go a long way in preventing cardiovascular disease, certainly globally, but also here at home in India.
So there's one question on like cheese and like dairy products. Uh, are they helpful in if a person goes to exercise? So eating more cheese and more milk, dairy products is beneficial, or like we have to keep that under control too?
Certainly, I think cheese or any dairy products has a lot of calcium, which is a healthy way of getting calcium, good for the bones. It also has other health benefits. It depends on the amount. If somebody is eating a lot of milk products or dairy products, it's better to drink low-fat milk or 2% milk rather than whole milk, which has obviously more fat in it. Similarly, yogurt is probably one of the more, if you will, beneficial form of dairy products. So curd or yogurt is healthy. Cheese, cottage cheese is healthy. Everything in moderation, though, because some of the dairy products do contain fat.
So can we move on to this question?
Sure.
Approximately every 1 in 3 heart failure patients has diabetes. What are your views on benefits of SGLT2 inhibitors in HFpEF patients?
Right. So diabetes is a problem, certainly globally. In the part of the United States where I work in El Paso with a big Hispanic population, it is a problem in India. And in India, it's a bigger problem because in rest of the world, most diabetics are obese, when in India, even thin people get diabetes. So without significant obesity, maybe some degree of abdominal obesity. Heart failure is a big problem, both among diabetes and without diabetes. And among heart failure, we have heart failure with reduced ejection fraction, heart failure with borderline reduced ejection fraction, and then a big group, about half of the heart failure patients have, 50% have heart failure with preserved ejection fraction. And for many decades, we didn't have any effective therapies. We treated them with what we used to treat for heart failure with reduced ejection fraction, including ACE inhibitors, beta blockers, diuretics, with not a significant benefit. We've been fortunate in the last couple of years. There are two classes of drugs that have shown promise. One is ERNI, which is essentially a combination of an ARB with an neprilysin inhibitor, and it seems to be effective, shows some degree of effectiveness in heart failure with preserved ejection fraction. The other group of drugs that has shown market promise, including some reduction in mortality, but primarily reduction in rehospitalization, are SGLT2 inhibitors. And there have been more trials with both empagliflozin and dapagliflozin, and both showing significant promise, and it is becoming a standard of care for using both an ERNI or an angiotensin receptor blocker with a neprilysin inhibitor and SGLT2 inhibitor in these patients with heart failure with preserved ejection fraction, both with and without diabetes. I should emphasize that these drugs can also be used in the two-thirds of patients, maybe without diabetes, who have FFib.
So coming back to the question on your topic, like for primary prevention of cardiovascular diseases, what is the difference, difference of how important it is for people to know about how to prevent this rather than joining a social media campaign or something like this? So what is the difference, what people do in your place of practice, and over in India, what are the differences, and share some lights?
Right. Primary prevention is basically preventing heart disease. So there is not a lot of awareness. I think people get serious about treating heart disease when they do develop heart disease, when they go to the physician. But primary prevention basically starts at a very young age. I mean, you guys are in your 20s, and primary prevention should start there. I think the first thing is at probably around mid-20s, so at the age of 25, getting a cholesterol level and a checkup to see, because there are individuals at very young age who have high cholesterol, and if you don't treat them, they'll get heart disease in their 30s and 40s. But primary prevention should start at a very early age. There are many awareness campaigns. In my country, American Heart Association and American College of Cardiology, they have the heart healthy lifestyle steps, 7 steps to prevent cardiovascular disease. And we talked about diet, exercise, cholesterol, high blood pressure, not smoking. There needs to be more awareness in India about these, maybe apps to measure somebody's risk, but also making individual aware that heart disease starts very early in life, in 20s, and that is the time. If you do the healthy lifestyle, you're going to be very, very happy in your 40s, 50s, 60s, because your lifestyle in the 20s and 30s will define the risk of your cardiovascular disease in 2 or 3 decades.
Shifting from a lifestyle modification and dietary points of not having cardiovascular diseases, if we move on to the stress levels, and how much is the stress and the hypertension that and the endpoint which is hypertension that leads to the cardiovascular disease or diseases for other organs like kidneys and all.
Right. So, apart from the lifestyle, stress is part of our life. It's impossible to eliminate stress. The only time we probably have no stress when we're children, toddlers, and maybe, even, in a teenagers or when you go to college, you've got stress. It's hard to eliminate stress. Exercise is a good way of de-stressing, because when you exercise, our brain, our body makes endorphins, which helps relieve stress. There are certainly there are other maneuvers or things somebody can do to relieve stress. Yoga, which was introduced, comes out of India, has become a national movement, and there is evidence that yoga can relieve stress, and relieving stress can reduce hypertension, and which in turn may reduce the risk of somebody developing cardiovascular disease. Absolutely.
So, like the prevalence of hypertension is almost the same around the world, but people do have different dietary aspects. Indian food is known for its spiciness
Right.
than other countries. So, is there like Indian people are more prone to cardiovascular diseases and heart attacks? So, does that make like what's the difference, and what's the part of diet into the
Right.
disease?
Absolutely. I think among the food ingredients, the one component that has been shown to have the best association is salt intake or sodium intake. And South Asians, some of the food can be more salty than maybe some other parts of the US or some other parts of the world. I think the food that has been shown to have the most benefit of reducing cardiovascular disease has been called the Mediterranean diet, and they have diet rich in nuts, fruits, olive oil instead of other kinds of oil. Per se, there has not been an association with the spiciness of the food, which is also hard to measure, with the understanding some of the spices are actually beneficial. Like ginger has some health benefits. There are some benefits with other spices. I think spiciness of the food may have more correlation with gastric symptoms. Individuals in India may have more dyspepsia or peptic ulcer disease if the food is particularly if there is a lot of chili or if it is very spicy related to how hot the food is. But among food ingredients, sodium intake is one of the key elements which increases the risk of hypertension. There is a way you can use salt substitutes, certainly can be beneficial. There are studies out of other Southeast Asian countries and out of China showing that using potassium form of salt instead of the sodium may have some benefits in reducing hypertension and in turn cardiovascular disease.
Thank you, sir. Thank you.
Thank you very much.